Sacroiliitis is a very common problem that I see in my practice, and it's a very underdiagnosed condition that creates back pain. The sacrum is basically the base of the spine, and the sacroiliac joint is this joint that connects the spine to the remainder of the pelvis. When this joint becomes dysfunctional, it becomes inflamed, and it creates or it causes pain in the low back. This pain can actually cause pain in the groin, not only pain on the back of the hip and the low back, but it also radiates pain down the leg, down to the knee generally. And this is a condition that can be treated with physical therapy. It can be treated with injections into the sacroiliac joint, injections that have steroid medication in it. It can also be treated with anti-inflammatory medications. And in the worst case scenario, if the condition has not resolved with conservative management, then we can do a sacroiliac fusion procedure, which is a minimally invasive procedure that is performed to fuse the sacroiliac joint.